So this is our 19th video today, and I'd like to just continue thanking our staff and our community for all the support that you've given this hospital. So we're continuing to monitor what's going on in our community with COVID. We're continuing to get advice from our medical staff and certainly reading what's going on with CDC guidance. With that being said, we're getting back to a sense of normalcy. We're going to keep doing these videos as we need to, but we're going to start getting back to in-person meetings as much as we can. A couple of weeks ago, it was an incredible time. We saw our numbers get down to 2 or 3 patients in the hospital being COVID positive. Unfortunately, over those last couple of weeks, we've seen our numbers continue to climb. The other day we hit a high of 29. Today we're at 24. We are seeing a change in the demographics of patients that are contracting COVID and needing hospitalization. We used to be in the 60s and 70-year-olds that were mainly hospitalized. Now we're seeing patients in the 30s and 40s. Almost all patients who have been hospitalized in our system over the past month or so have not been vaccinated. Vaccinations are still the best way to keep out of the hospital and stay safe from this disease. We believe that the increase in hospitalizations is due to many factors, but the most important factor being we still have a large part of our population in Sarasota that are unvaccinated. So we know people are spending more time indoors because of the hot weather outside, but we also know there are variants in this community. We are also continuing to see our population and our community try to get back to normal, and that means going to restaurants. That means seeing friends and being in friends' homes. That is all great news. But we need people to stay vaccinated, and if you're not vaccinated, get vaccinated before you get completely back to normal. Stay safe. That's our message. So throughout the pandemic, we've evaluated and adjusted our COVID policies. One of those is masking. We still require people to come into the hospital that are in public places or with patients to wear a mask at all times. Visitation is another big area that we continue to look at and adjust. We have loosened our visitation restrictions over the past couple of weeks. We have more visitors coming into the hospital to see a patient. We have more extended hours. We're going to continue to monitor COVID in our community and adjust our policies accordingly. So we think it's very important to get our staff's feedback on how everything is going at SMH and how people are engaged into their particular jobs. We do this survey every 3 years, and we really try to get 100% participation from our employees. We had to skip it last year because of COVID, so it's actually been 4 years now since we have had a Gallup survey. We're excited about seeing our results. We're excited to hear everybody's feedback. And I just want to encourage you to take the survey so we really get an accurate picture of where we are today. Every 3 years, hospitals are required to have an organization come in and survey them to make sure that we are adhering to national standards. We contract with Joint Commission as our vendor to be able to come in and do that. So now is our time to have Joint Commission come in and take a look at what we do, and really our time to show how proud we are in what we do and get to show the nation how well we do what we do. The nature of these surveys are that they're a surprise survey. They're probably a little bit past due right now, so we're waiting any time for a survey team to come in on a Monday morning. We'll send out a group message throughout the organization, let everybody know they're here, and for that week we'll have our time to be able to show off a bit. This has really been an unprecedented time in the nation's history and as well as Sarasota Memorial's history. I am so proud of our staff and our community. Our medical staff have all come together and really shown leadership and how to get through a pandemic now. Hopefully we never have to do this again. But you know what? We were shown the world how to do it right. Of course, it's not over yet. If you haven't done so yet, please go get your shot. Thank you.